Good morning, everybody, and welcome. We are so glad you could join us today for our age-friendly university takeover. My name is Jocelyn Protopappas, and I'm the Manager of Special Projects at the Center for Excellence in Aging and Longevity at San Diego State University. If you've been following along, you know that all month long, we've been celebrating our very first age-friendly university month at State. To help us celebrate, we've invited universities from across the Age-Friendly University Global Network to share initiatives and programs from their university that help to support the 10 principles of the Age-Friendly University. These 10 principles encourage lifelong learning, intergenerational connection, and inclusive environments for people of all ages on campus. These principles remind us that learning doesn't stop at graduation. It grows with us throughout life. Today, we'll be exploring one of those aspects of the age-friendly university, the built environment, how the physical spaces on campus can shape engagement, accessibility, and belonging. From how our campus maps are designed, to walkways, to gathering spaces, the way we build and organize our surroundings deeply influence how people connect and participate. Today with us, we're thrilled to have Jodi Waterhouse, the Director of Strategic Partnerships and Program Director at the University of Colorado's Anschutz Multidisciplinary Center on Aging. Whew, I thought that the Center for Excellence in Aging and Longevity was a mouthful. Jodi has done some really incredible work on studying how the built environment impacts engagement across generations. She will share some highlights of some recent research that she's done and talk about how universities can design spaces that invite everybody in. Please help me in welcoming my colleague and a great friend, Jodi.
Thank you, Jocelyn, and thank you everyone for having me. This is an extra special presentation because I'm presenting to my hometown. I'm a San Diegan, and so I love learning through certainly the programming at San Diego State, what is happening in the aging space back home. So this is extra fun to be with all of you today. So Jocelyn's asked me to talk about our work in the age-friendly university designated campus. And so I'm going to focus today on our built environment, but I really want you all to take away from this that while we're going to focus on higher education, so much of what I'm going to share with you today can be implemented in your communities, back in your own organizations, within healthcare systems. So don't think because it's just happening at a university that it can't happen in other places, because it absolutely can. So without further ado, there we go. All right, so what are we going to talk about today? What are the objectives? We're going to talk a little bit about just what age-friendly means, and certainly in the higher ed space, but in some other sectors as well. We're going to specifically use the higher ed campus as an example for today's conversation. But again, keep in mind that a lot of the foundations can be applied to other areas throughout your work. I'm going to share with you a little bit around the survey that was created to help support higher ed institutions to become more age-friendly, and our friends at the University of Massachusetts that's helped us do that. We're going to talk about the unique needs for us as a higher ed institution being a medical campus, which is very different to many other campuses. We're going to then talk how we've assessed what we have done, and then what are the results to date with our built environment work. So what is age-friendly? I get asked that all the time. Well, it sounds snazzy. What exactly does it mean? And through our lens here at the Center on Aging at the University of Colorado, we are very focused on specifically the older adult population. However, again, age-friendly is across the lifespan. Ageism happens across the lifespan, and so many of these principles and definitions and foundations that we're going to talk about today really can be applied to many different age groups. So an age-friendly environment is one that just supports healthy aging. We're all aging, regardless of our age. And so how can we ensure that our physical and social environments are meeting the needs as we age? We're moving those barriers. So ensuring that the policies, the systems, the products we're creating involve the people that are going to be utilizing those policies, those systems, and or products. So how do we become more inclusive? Recognizing the diversity in certainly older adults' capacities and circumstances. We all age very, very differently, and we cannot take a cookie cutter approach to this work. Anticipating and responding to the older adults' needs and preferences, making sure we're doing that in an equitable way, and then respecting the decisions and protecting the vulnerable, who are, whether they're coming to our communities, to our campuses, into our healthcare systems. We really need to live by these standards. So on the right of the screen is the age-friendly ecosystem wheel that, again, we really use as our guiding light to ensure that we're fitting into that wheel. How does higher ed fit into that wheel to make sure that we're doing this age-friendly work appropriately? So in addition to higher ed being age-friendly designated, of which I know San Diego State is one, the other areas are employers. So ageism in the workplace is rampant across our society, unfortunately. I hate to say that it is. So through the CAF program, it's taking companies that are really invested in this age-friendly work and designating that they are indeed meeting these requirements. So this is across sectors. As you can see, healthcare, nonprofits, corporate, security services, local government are participating in this work. Unfortunately, it's still a pretty small number, so tout widely with your colleagues around age-friendly workplace work. But you will recognize some of the organizations that are listed here that have gone through this process. There's also age-friendly work happening within our health system. So here in the state of Colorado, and here at the Anschutz campus, our University of Colorado health system has become age-friendly. And there are hundreds of healthcare systems across the country that are following the 4Ms framework of delivering healthcare. This designation comes through IHI, so the Institute for Healthcare Improvement. And on the right-hand side of the screen, you will see what the 4Ms of geriatrics represents. And this is really, really interesting work. I know they're in San Diego. Actually, you were one of the first locations, I believe, at Thornton Hospital who had a geriatric emergency room. So there's lots of movement in the healthcare space around becoming more age-friendly. So today, for purposes of today, though, we're going to talk about higher education. So here's an aerial view of where I'm sitting right now. This is the CU Anschutz Medical Campus. We are part of the University of Colorado system. So our sister schools include CU Boulder, which I'm sure many of you are aware of, CU Denver, which is our downtown campus, and then CU Colorado Springs. We are the only academic medical campus in the state of Colorado. We also serve within our healthcare systems on the CU Anschutz campus. We serve 7 other states, 7 surrounding states. So in this photo, if you kind of look to the left of the photo, you will see a large hospital. That is UC Health, of which we are a level 1 trauma center. So there is acute care and outpatient care. Directly behind that building is the University of Colorado. So while we share the same campus and we work very closely together, we are 2 separate entities. The bottom right hand, you see a large building there. That is the Children's Hospital of Colorado, a significant partner here within the CU Anschutz system. And then not pictured on this particular photo, but if you look to the far, far right, you would see the Rocky Mountain VA. And that is a huge medical complex as well. So we have about 30,000 people who come in and out of the CU Anschutz campus daily. And that includes patients, that includes staff and faculty on the university side, and that includes certainly our veterans visiting the VA. So you say, oh my goodness, how do you even tackle age friendly when it comes to this? Because when I am in the community and say, you know, I'm with CU Anschutz, people love CU Anschutz, but they say, oh, I could never go visit there. It is so overwhelming. I don't know how to navigate. I don't know how to find the right building that I'm supposed to be in. And San Diego State is really no different. We're a city within a larger city. And so for the outsider who doesn't come to our campuses regularly, that can be extremely overwhelming and not terribly welcoming. And we spend a lot of our effort, as does San Diego State, in building that bridge between campus and community. And if we aren't accessible, we aren't navigatable, we aren't welcoming to our guests, then we're really going to sit kind of on an island ourselves. So as I'm going through the work that we've been doing, I am specifically talking about the work on the university side. While UC Health has become an age-friendly health system, which is fantastic, for today's purposes, I'll be talking strictly about the university. So where did this all happen? When? How did this all come about? So back in 2021, I approached the chancellor, sat down with him and just said, look, let me educate you a little bit about an age-friendly work that is starting to really take off across higher ed institutions worldwide. I think we are very well positioned as an academic medical campus to participate in this work. And boy, he immediately said to me, literally, duh, why are we not doing this? And so we submitted our application. And then in December 2021, we're notified that we became an age-friendly designated campus. We were the first to become age-friendly designated within the University of Colorado system. I'm thrilled to say that our sister institutions at both CU Denver and Colorado Springs have both become age-friendly as well. And we're just waiting on Boulder, and then we will be an entire age-friendly system within and under the UC, the CU umbrella. So that's super exciting. We were second in the state of Colorado, and we always give a hard time to our colleagues up at Colorado State, but they were the first in the state of Colorado to become designated about 6 months before we did. Boy, we learned a lot from them. So I always encourage other campuses to team up with campuses that have gone through the process to really navigate this work. And we're just thrilled to work together very closely in all that we do in the age-friendly space. We are still only one of 4 academic medical campuses in the world to become age-friendly designated, which makes us a little bit unique compared to other more traditional campuses. We're dealing with some things that don't necessarily happen at more traditional undergrad and graduate campuses. And then when we did become designated back in 2021, we were number 87 in the world. And now after our last meeting, I think it's 140 higher ed institutions now that are designated. So prior even to submitting our application to become an age-friendly campus, I created an age-friendly university task force. Partly that was a little selfish in that I did not want this to appear that this was Jodi's passion project just because she happens to like older adults. And so you really do want to make sure that you're involving key stakeholders, whether they're from your community, from your campus, from your health system. While all of these initiatives need quarterbacks and champions and cheerleaders, we also need people who represent different facets of areas that we may not necessarily work in, who can be our eyes and ears in this work. So even before we submitted our application, I started to handpick around campus representatives who I knew were very interested in work in aging, whether through their research, their clinical care, education, so teaching and learning in their classrooms. And here at Anschutz Medical Campus, we are the home of the School of Medicine, the School of Pharmacy, the School of Dental Medicine, the College of Nursing, and then the Colorado School of Public Health. So it was very important to me to have representatives from each of those schools in college. Again, they could go back, take messaging back for me. They could be my eyes, my ears, to let me know what was going on in each of those schools. In addition to the schools and the college, there are also significant partners within various departments across campus who are key to making sure this work was successful. And that includes representation from our Health and Wellness Center, our Student Affairs, certainly our Human Resources Department. Facilities became a key partner, of which I'm going to talk about a little later. Marketing, strategic planning, so that we can be in the discussions that as the university is moving toward new strategic plans for the next few decades, is age-friendly work also embedded in that. The key part to all of this, in addition to the campus stakeholders, though, are community older adults who are coming to our campuses who can give us feedback about what is the experience like. We know our campuses pretty well. We come to work here every day. Sometimes we forget how difficult it is to navigate. And so having community older adults be our eyes and ears outside of campus were pivotal in this work. So the age-friendly university designation has 10 principles and 6 pillars. And the 6 pillar areas that I could actually absolutely 100% pitch to our chancellor that we meet each one of these. Instead, rather than tackling all 6 at once, I highlighted for him and in our application, who are we? Who are we as a campus? What are our areas of strength? Well, we are the only academic medical campus and the only R1 institution in the state of, as a part of the state of Colorado. And so research is our backbone. So we could certainly highlight the work of research and innovation. We had existing programs where intergenerational learning is happening in the classroom. And then Encore Careers and Work, we had just been awarded a new workforce development program for older adults on campus. So I knew I had those foundational programs already that were easy to stand up rather than having to create something from scratch that I may not necessarily have had the right representation for. This I could lean on. But absolutely, teaching and learning, lifelong learning, and civic engagement is happening every day here on campus. When the AFU task force all came together and started this work, we really identified a few different areas across campus that we felt we could tackle first. But we thought our lowest hanging fruit was truly our built environment. If people didn't want to come here, or hated coming here because they couldn't find parking, they couldn't find the building they needed to be in, it was just overwhelming, then how in the world were we going to build that bridge between campus and community? And so we really had to look at ourselves in the mirror and say, look, we need to be much more of a welcoming campus for our visitors. So the task force decided the built environment as our first priority. So how do you even go about that? We are huge institutions, same as San Diego State. It is a big initiative to take on. And so at the same time that we were starting this work, the work had really already begun at the University of Massachusetts. And they created the Age-Friendly Inventory and Campus Climate Survey. They had selected 25 universities across the country to really try out this survey. And Colorado State was actually one of those. And so it was fantastic because while we were not originally selected, they were. And so we could really learn of what worked, what didn't from them, and then also our colleagues at the University of Massachusetts. So just a quick snapshot of what does that survey look like? It is long. It has many segments included in there, and you can see the 10 sections that are included. But since we were very focused on built environment, we obviously wanted to pay very close attention to the facilities and planning section. Now, do keep in mind, as I mentioned, we're one of only 4 academic and medical campuses in the world that are age-friendly designated. So some of the survey questions were not applicable for us in particular, because they were really more geared for that traditional undergrad and graduate type of university. So what we did in working with the University of Massachusetts is we really customized the survey to better fit kind of who we were as a campus. Our student body is radically different. The only undergrad program we have is in our College of Nursing, which is a BSN program, but everyone else here are becoming doctors, pharmacists, dentists. So we have a very different student body. Also, looking at our staff and faculty, we have patients that come daily to campus. That is radically different than other higher ed institutions, because the patients are being seen in clinics that are located on campus. And then being a large R1 institution, research institution, we have hundreds of study participants that come to campus daily as well. So take all of that, plus our community members who may come here for events or to take a class. We've got a lot of different types of visitors that are coming to campus. So we really took that information and then created and modified slightly the survey to better fit an academic research institution, medical and research institution. The other thing that was very, very unique that we did, that I highly recommend in any of the work that you are doing that may involve age-friendly work, is that you have got to have who is visiting you, whether it's at your organization, here in your community. You've got to take people who work in it daily and people who visit it and bring them together. And so we created pairs of community members and a campus representative, where they would pair up and they would walk through the experience of coming to campus, from parking your car all the way to paying to park, to navigating your way on campus, to getting to the building that you want to get up to the floor that you need to get to. The campus reps walked through that experience with our community members and really, really felt and saw and heard the experience that our visitors go through. And that was hugely enlightening for many of our campus representatives, because they had never noticed that there wasn't a restroom sign there before, because we just all know that the restroom is there. Well, our community members do not. And so they really opened our eyes to what is missing and where are the glaring gaps across campus. So this is a pair pictured here. This is Lindsay from our Human Resources Department, and then Faith, who is one of our community older adults. And they were given a 17-page survey, of which there were questions that they needed to answer and then elaborate on. If there was something that worked really well, we wanted to hear about it. If there was something that was a glaring gap or was missing, we definitely needed to hear about. So they would literally start in the parking lot all the way into the building that they were assessing, from step 1 all the way to step number 100 of this particular survey. And so the categories aligning with the survey coming out of University of Massachusetts, which was just phenomenal, but were specific to the AMC campus, was that physical accessibility and campus navigation. I think as large campuses, we all suffer from people really trying to figure out where they need to be on campus. Many of our buildings look all of the same. And can be very confusing for our guests because they look all the same. The campus maps are not terribly effective. We make people park very far and walk onto campuses. Signage sometimes is a little sparse. And then certainly, do we have enough restrooms in public areas that people can access? So it was really a thorough assessment that each of our pairs did. The pairs were assigned to a particular building or space on campus. They did not assess the entire campus. There would be no way that a pair could actually do that. So instead, we divided up the campus buildings, prioritizing those that are most publicly used to assess. And then that way it was much easier for them to really spend a lot of time at that particular building. So some of you at San Diego State may be able to relate to this because we're all guilty of it. Campus maps can be really confusing for the outside world to come visit us. So physical accessibility and campus navigation was one of the areas that we really wanted to spend a lot of time on. The photo to the left is a screenshot of the old campus map. So that is what went out to visitors with information of labeling buildings on campus in hopes that people knew exactly which building they needed to get to. You can see from this campus map, not only is it busy, there are multiple colors. There are very small areas that people are trying to see what does that actually say. And this was truly the size that was located in big campus kiosk areas as well as on people's phones. So this is what they would pull up. So we took that map and specifically when assessing certain buildings, and they concentrated, the pairs did on their building, how do we identify a campus map that is easy to use, that has much larger font, less use of colors, that was well labeled, especially highlighting the more public-facing buildings where we know a lot of our public is coming to daily. And so the example on the right is what came out of this campus map exercise, which, as you can tell, is much easier to read. It labels the buildings much easier. We really muted campus colors on the map so that it was less distracting, and especially for our visually impaired. So this is a map now that we can customize also to share with our guests, both on electronically as well as in our campus map kiosks. So you can see our before and after. We have these huge kiosks around campus, but my goodness, walking up to the one on the left, so before, I'm not exactly sure I would know where to start. And so our after really highlights the campus buildings that, again, are more public facing, that tend to be closer to guest parking lots, that is much more easy to navigate. So then what did we do next? Well, what is our parking experience? And if there is one complaint, regardless of all the different universities that I have been at, is the parking. And people complain about accessing the parking, the distance the parking lots are away from our campuses, paying for parking. So us in higher ed have a constant parking battle. However, we did want to make sure that if we have designated parking areas, you know, were they feasible and close enough to access for the buildings that people needed to get to. We knew in this work, we weren't going to be able to move major parking lots. There's just no way universities can do that. But can we make it easier once people arrive to their visitor parking to navigate the parking kiosks so they can pay for their parking, and then the navigation of getting them to their buildings? So the serendipity of all of this is that this gentleman pictured here was a morning that we were having an age-friendly university task force meeting. And he was on his way to participate in a research study and was told to park in a parking lot that was directly behind the building he needed to be in. So perfect location, short distance to walk. However, that parking lot by the time he got there was full. And there was no indication on his parking directions of where to park his car, since the parking lot he's supposed to be in is full. And so he is wandering around another parking lot that wasn't too far away from the one that he was supposed to be parking in, looking for signage, but also looking for the parking kiosk to see if there were directions around, is this okay for me to use as overflow parking? And so one of our staff members on the Age Friendly University Task Force happened to be walking in from her car, saw this gentleman wandering, really kind of upset and confused. And so that was a perfect example of, many people not thinking that the parking lot I've assigned, I've given great directions to a parking lot, but if that is full, where do our guests go next? And then how to navigate the parking kiosk. Some of the exercises that when our pairs were out visiting our parking kiosks, you'll notice that the two left pictures there, especially the one in the middle, here at CU Anschutz, the afternoon and morning sun is really bright. And depending on the direction that the parking kiosk meters are facing, there is no possible way that you can read that tiny little sign, which are the directions of how to pay for your parking. So the photo on the far right is a little cabana that we've now put our parking kiosks in, so that they remain shaded all day long. So regardless of the time of day of when you arrive. Simple things like that. No one had really said, boy, I can't really read the directions on the parking. So how do I possibly pay for my parking? The other thing that we realized is we put parking kiosks in our visitor parking lots that are a block away from the crosswalk. So you have to walk to one end of the parking lot to pay your parking, and then to cross the road safely, you have to walk to the other end of the parking lot to walk and utilize the crosswalk. And so the facilities were fantastic in our assessment of campus. That really doesn't seem very effective. They moved crosswalks because that just involves some white stripping. They moved crosswalks to align with parking so that we could ensure that our guests were crossing the roads safely. So walking distances, while this map on the left is not for public use, it's more of an internal map. What we used it for was of signage. And here on the CU Anschutz campus, we use, and many campuses do, the light posts as wayfinding signs around campus. Well, what we were discovering very, very quickly is signage was a little sparse, or the correct signage was a little sparse on navigation. So while it said, welcome to CU Anschutz, it certainly didn't tell me exactly what direction I need to go for the building I'm looking for. The other thing we found is our light posts were so tall that people were having to crane their neck to look up to the wayfinding signs. And so we actually lowered light posts across campus in certain areas to make it much more easily navigatable. And so through this exercise, we added about 10 more navigation signs across campus because we realized that either navigation signs weren't put in the right spot on light posts, or there weren't enough of them. So that was an exercise that we also did with facilities. Signage is always an issue. You don't want to have too much so that your campus or your community is just blanketed in signs, and then it gets a little overwhelming. But I would say we probably go to the other extreme where we don't do enough signage, or at least appropriate signage. And so while we, as I was talking about on the light post, we had, plenty of, CU Anschutz, you're on the CU Anschutz medical campus. That is fantastic. But the navigating signs on the right, the banners, it was very difficult to read. And then the arrows that were pointing to the buildings weren't very helpful. And so we also had no signage to say that we were an age-friendly university. So we've switched out a lot of the navigational signs, moved them more strategically around campus, and then we dispersed our age-friendly signs, which has been terrific too. The large statue in the middle was added in place of some navigational signs that we were using on light posts to be much more apparent. If you're walking on a sidewalk on one of the roads behind the buildings, where can I find the certain building that I am going to? The other thing that, again, as staff and faculty, we come to our offices every day and we may not necessarily notice, but if you look in the before picture versus the after picture, our elevators in this particular building are flush with the wall. So you would have absolutely no idea that right behind that wall was the bank of elevators. And so we had no signage for when guests walked into that building to indicate where they can get the elevator. We had great signage for restrooms, so we could find the restrooms, but we could not find the elevators. And so people would be wandering around the building asking others, where is the elevator? So simple elevators with an arrow was added to this particular building. But again, we come to work all the time and don't notice necessarily that that is a problem. This was restrooms. So in looking at many of our restrooms across campus, ADA does require one push knob for disabled visitors to use. And so again, the serendipity of AFU meetings, I need to host these, I guess, more often on campus because we always seem to walk out of the meeting and then see an example of something happening. And this was a lovely woman who was trying to make her way into the restroom, but specifically for our population, you can see she's utilizing a walker. Now, her walker is different in that it's much longer than the traditional walker. So she was trying to open the restroom door, did not see the push pad, which quite honestly was a little bit hidden. So I have to admit that that was not located in a very appropriate spot. She is bending across her walker to open the door. Now, if someone had come barreling out of that restroom in a hurry, so a student who might be trying to make his or her way to a class, she would have knocked this poor woman over. And so one of our AFU task members was going to the restroom and then helped this poor woman open the door. What we found is once she was ready to leave the restroom, that there was no button, so the handicap button, inside the restroom. And we aren't required to put those inside restrooms, so people can get into restrooms, but they cannot get out. And so again, she would have had the same issue, leaning across her walker to try and open the door. And again, if someone was on the other side of the door coming in very quickly, we would have sent this poor woman flying. So they have added and moved the pads, the handicap pads to open the doors based on the work that we pointed out to them. So, across the board, this is a campus commitment, and I can't stress that enough. If not, it just looks like in our case, the Multidisciplinary Center on Aging, happens to like older adults. And so we're doing this work to make sure our older adult guests have a pleasant experience when coming to our campus, but it has to be across the board. It cannot be solely an initiative that is just out of one center or department. And so having those key stakeholders representing different parts of your community, different parts of your campus, your organization is key. And so the buy-in through this work and coming out of the chancellor's office has been really tremendous. And all universities, list their designation highlights. And so Age-Friendly University has been added, which sometimes just to even get that added is quite a challenge. And so, we celebrate these small victories when they happen. And then, as the picture I showed you of Lindsay from our Human Resources Department, she serves on the AFU task force, and she has just led a complete charge through Human Resources, not only in our workforce development program, but also in adding the designation to the Human Resources website and the verbiage. So on the right-hand side of our diversity and equity statement, that is listed in all job descriptions. So she really has been fabulous at helping to lead her team on hiring older adults, recognizing that the hiring practices need to happen across all ages, and then being out in the community talking about the age-friendly recruitment strategies that we do here at Anschutz. So for that, we are very, very thankful. Something as simple as how do we get our guests to and from campus, I think is key. Think about all the different departments that any given campus has, and they're all sending out somewhat the same information, but could be radically different. And so how do we customize and have one packet that we're all using that we can share with our guests? And so the committee really came up with the elements that need to be standardized in our visitors packets that include campus parking directions, visitor parking lot locations, and then giving each of the departments areas where they can customize, for branding of their event or their research study or whatever it is that they're working with their guests on. So this packet has been used a number of times now across campus. And it's just really great to know that we're working all off of the same document, and that if there are changes made, then through the AFU task force, we share those changes so they can take them back to their respective areas across campus. So standardizing some language, standardizing the use of campus maps and directions, is really key to make sure that we're not sending people in a million different directions when they come visit. So regardless of whether you're with a higher ed institution or you're wanting to take this work to your community or to other organizations, these are really the guiding lights for us that we pay very close attention to, not only through our Age-Friendly University Global Network, which is a huge resource for us that we're sharing across campuses worldwide, but also our partners, certainly at AARP, specifically Livable Community Work, and through the World Health Organization, which I'm thrilled they really do quite a bit of work in this particular space. And so the 8 domains of livability through livable communities, we very much lay that kind of over the work that we're doing because we are a community within a much bigger community. And so are we meeting all of these needs with the exception of the few on our university campus? So these become really, really important resources to help guide our work. And I wanted to make sure that you're all aware of those. So with that, just want to acknowledge the Age-Friendly University Task Force. So you can see there, while you don't necessarily know the people, you can see the departments, divisions, schools, centers that they represent across campus. And then certainly our community members and the Chancellor's Office for really being great supporters in this work. So with that, I will stop sharing my screen.
Thank you, Jodi. I just really, I love this, the ideas that you gave throughout this presentation and building the age-friendly environment. Some of them are so actionable. And as you were sort of speaking to the sort of parallels you see at SDSU, I was laughing because yesterday we had an age-friendly event on campus. We did a caregiver resource fair that was aimed at students who are caring for older adults, but also parent caregivers. And in the middle of this event, everything's going fabulous. This gentleman came up to me and he was like, "Where is this building on campus?" And he hands me his phone with a campus map at it. And I've been a student at SDSU, staff at SDSU. I'm standing there with the phone, turning it in circles, trying to, figure out where I am.
Figure out.
Oh my gosh.
I know. It's a problem that we all face at
Yeah.
higher ed institutions.
Yeah, and he said, it's so gorgeous here, all these sandstone buildings and everything is,
Yeah.
all the palm trees. He goes, but everything looks the same. I'm so turned around. And I was like,
Right.
boy, me too, my friend.
Yeah.
So,
Yes. Yes. Well,
so
I'm
thank you
glad you were
for,
there to help him.
well, oh, well, we had to then go look at the actual campus map. But anyway, I
Yeah.
mean, the phone wasn't helping. But I just wanted to ask, last week we had a panel on and from different universities, and I got to ask them a few different questions. But and I kind of want to ask you some same
Mhm.
questions since we
Mhm.
didn't have any in the chat. But the number one question I wanted to ask is why do you feel that it's important for your university in particular to be age friendly? Have there been benefits you've seen already? Why was this work so important to you outside of that, the passion I know
Yeah.
you have?
Yeah, exactly. So there were a couple reasons I think that was really driving this effort. And first was to educate our internal campus, right? You could have walked around campus prior to 2021 and asked someone about age friendly university work, and they literally would have looked at you like you were crazy. And so people just they didn't understand, they didn't even know that that existed. And so part of it was getting us as a university to think, do we really serve our community over the lifespan? Are we doing it appropriately? Or are we segregating people into certain population buckets, right? Oh, those are older adults. Oh, those are our students. That's our faculty. So it was both an internal education and thinking about culturally across campus very differently. Secondly, while I was doing all my work in the community, trying to build these bridges back with campus, and people were telling me, I don't want to go to Anschutz because I don't want to have to park there or go to a building. So now you kind of are saying, oh, goodness, here we're doing all this wonderful work in the community. And while I think bringing campus into community, absolutely important, we also need people to come to campus, right? And so, how could we make that experience much more appropriate, much more equitable, much more inclusive? And so it was really kind of a two-part equation that we were balancing both for our internal and our external community.
I love it. And you provided quite a few strategies. And I know when we've talked in the past, different strategies for helping to get buy-in from your campus. You
Mhm.
mentioned things like having a variety of people on your
Yeah.
work group, and even doing projects that really do bring in the community, like having
Mhm.
your older adults
Yeah.
pair up with somebody so they're, we can look at it through a
Yeah.
different lens. Any other recommendations for universities who are thinking about the age friendly university, and any other strategies for getting the ball rolling?
Yeah, yeah. You really do need to have a champion at the leadership level, who really is invested, who understands the importance of it. Higher ed is going to be turned on its ear. um, we are having to change the way higher ed is delivered, how we are a community member, very very dramatically different than what we have done in the past. So how as a university's college campuses do we look at education for the lifespan, right? And how do we help support that? So you've got to have leadership who are invested in that. And then from that, those representatives are key stakeholders that bring ideas that you had no idea about because you just don't operate in that particular part of campus or understand that culture of campus, or how students access that particular part of campus. So having those representatives are certainly key. But as I stressed earlier, having those community members are huge. And we can sit all day long and think about how we interpret our community perceives us. And until you have community sat at that table where you are co creating these initiatives, then again, it's very one sided. So there's different levels and steps, but what leadership needs to understand, and they do because they're dealing with it every day, is higher ed is changing. And higher ed, I'm going to be taking higher ed well into my 70s and 80s in the future. because that's just as an aging population, we are going to be changing how we deliver education throughout the years. And as a good community partner, we want to make sure we're doing that appropriately.
Well, I love it. Thank you, Jodi, so much.
Oh.
I was saying earlier to you before the call that hearing these age-friendly university presentations is so exciting to me because it is, of course, you are speaking to the choir here, but
Yeah.
um, thank you so much for this presentation today and taking the time to share all of the great work that you are doing at Anschutz. For our audience, thank you for joining us today. We will be back next Tuesday for our final installment of our Age Friendly University Takeover. Thank you.
Thank you, everyone. Take care.